Welcome to Health Professional Radio. I'm your host, Neil Howard, and I'm real glad that you could join us for another segment. Going to be speaking with Dr. Dennis Hruby. He's Chief Scientific Officer at SIGA Technologies, and he's joining us to talk about some of the lessons that we've learned from this current COVID-19 pandemic and talk about whether or not we are ready for the next one and can we prepare for the inevitable. Welcome to Health Professional Radio, Dr. Dennis Hruby.
Thank you. Glad to be here.
We have spoken with one of your colleagues here on the program before, Dr. Gomez. We talked about health security as an industry and how it kind of operates. What I'd like to talk with you briefly about, Dr. Hruby, is this current pandemic, some of the lessons that we've learned, and how do we get ready for the next pandemic if we're not already preparing for it? So if you give our listeners a bit of your background.
Yeah, I'm a career virologist. I've been working in viruses for more than 40 years, in particular vaccines and developing antivirals. My particular area of expertise is smallpox. And as Dr. Gomez likely told you, we've developed an antiviral to treat smallpox should it ever reoccur. So drugs for rare diseases. With regard to your question about are we prepared, I would say the answer is no. We certainly, as scientists, have been warning for some time that a potential pandemic might be coming. A lot of people probably thought this was influenza. I doubt anyone thought it was coronavirus. And so we really don't have vaccines, antivirals, diagnostics prepared for the next unknown virus that comes into our environment. It could be a coronavirus. It could be a Nipah virus. It could be a flu. And so I think what this pandemic has taught us is we can never be too prepared. The cost of a little upfront investment to develop these countermeasures is far less than the toll taken on our society, both economically and personally, when a pandemic gets out of control like COVID-19 has. So I think preparation is vital, and hopefully we'll take this lesson to heart.
Countermeasures, are some of these countermeasures derived from current countermeasures for, as you said, the flu or SARS or MRSA or any of these other things that we combat?
Unfortunately, probably not. One of the unique things about viruses is they belong to many different families. All of them have some unique features. So vaccines or antivirals typically only work against a single family of viruses. Influenza vaccine only protects you against flu. Our smallpox antiviral only protects you against smallpox. So you're probably going to need a countermeasure for each family of viruses. There's some hope that we could produce a vaccine that would protect us against COVID-19, other coronaviruses, MERS, and SARS, because they're all in the same family. But that remains to be seen if that is possible or not.
Obviously, from, all of us watching the news, we know that there are many, many lessons that we have learned, especially that lesson of preparedness, not from a political standpoint at all, but from a medical standpoint. What are some of the lessons you think that we have learned that are going to help us tremendously in this next pandemic?
Well, I think it's clear we're going to have the countermeasures developed and stockpiled. I think the science of today has progressed to the point where we can do rational drug design and go after some of these unusual targets and actually develop them. I think the other major lesson we've all learned is the importance of diagnostics or testing, as it's known in the literature currently. It's crucial that we know it's happened, what it is, and how to deploy the countermeasure. The other part that's probably very important that is underappreciated is we have to have an operations plan about how to deploy our countermeasures, because we're never going to have enough in the stockpile to treat everyone at the same time. And so we have to have a plan about who gets a drug, when they get it, and how they get it. So all that can happen in real time without a lot of discussion between different agencies and meetings, et cetera. It has to happen in real time.
What do you say to those who feel that this concept of herd immunity is something that we should depend on, with all of the talk about asymptomatic people spreading it, maybe never ever getting any symptoms and never getting sick, but making hundreds of other people sick? Is this something that we need to embrace?
I think that's a big unknown. that all depends on the particular virus. Now, with coronavirus, what we don't yet know is whether people are asymptomatic or, in fact, getting a protective immune response. And we don't know for coronavirus if any immune response you get either from an infection or from a vaccine will be long-lasting. The paradigm we're working with is the typical coronavirus that causes colds every winter does not induce long-lasting protective immunity. And so if that's the case with COVID-19, we will never get herd immunity. My personal hope is that one or more of these vaccines will, in fact, produce short-term immunity, a year, 2 years, 3 years, so that it'll end up like the flu vaccine, that's something we have to get every year. That would, I think, take away the brunt of the disease burden in the population.
Do you think that would take the burden of this constant cleaning, mask? Do you think that is something that we can back off of if sometime in the not too distant future?
Well, if we get an effective vaccine that gives at least short-term immunity, I think we can at some point relax some of these measures. Whether or not we'll ever go back to life as we knew it, that remains to be seen. I think this pandemic has made us all hyper aware of the needs to maintain good social hygiene.
As far as the face of healthcare, do you think that it will ever go back to at least some semblance of what it used to be based on this new, very little or no touch type of caregiving and information sharing?
Well, I think this pandemic has been a nucleating point in evolution in the sense that we've gone to a lot of working remotely, some of which I don't think will ever change. And what I think you're referring to is telemedicine. That is now going to be, I think, a major way that a lot of our routine medical care and diagnosis is delivered. So I don't really see that changing a whole lot. I mean, I'm hopeful at some point we can go back to seeing our doctors and dentists face-to-face as we need to. But right now it's a dangerous place to be.
What do you see as the evolution of health security as far as tracking, raising awareness, and maybe even preventing pandemics in the future?
Well, my personal hope is that all the money that is now being devoted to COVID-19 will stay available so that scientists and health professionals can develop more and more countermeasures, stockpile them, be ready to deploy them to protect us against the next unknown virus that comes into our environment. So I'm hopeful that this will nucleate a new generation of countermeasures.
Well, Dennis, give us a website where we can learn more about SIGA Technologies and more about the healthcare security industry as a whole.
Certainly, you can visit the company website, which is SIGA Technologies on the internet, and that will have links to other articles and other databases. So that's one place you could go.
Thanks for joining us here on Health Professional Radio. Hoping we'll speak again.
Thank you for the opportunity. Have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.